Okay, what I'm going to start this this discussion while people are coming in the room, I want to make sure I give Linda just a couple minutes to say a few more things. She was right on the mark in terms of sticking to her 5 minutes, and I want to give her an opportunity just to make a few concluding comments before we go into the panel discussion. And as I said, I really want to get folks in the audience to step up with your questions. So you can start lining up in a minute. And Linda.
One thing I wanted to make really clear, based on a couple of conversations I had at lunch, is that what we have done and asked of communities is that every community know every person in their community who is homeless by name with enough information to triage them into the appropriate response. We now have evidence that shows that of the people who are homeless, about a quarter to a third of them get out of homelessness on their own. About half of them need a short intervention, 3 to 6 months of rental assistance, and 90% of the time they're not back in the system again. And then maybe 15% need a permanent voucher. The problem is every time we give it, somebody said earlier this morning, if there were free housing, I'd line up for it. Well, that's what people have done all over this country, is anyone who's poor can line up for affordable housing. The communities that are actually reducing homelessness are the ones who are saying, we're going to triage the people who come in asking for housing. And I think that's one of the most important things we learned, is that asking for housing should be more like an emergency room of a hospital than a bank. You should be given housing based on your need for housing, not by how long you've been waiting.
Thank you. I wonder if you could just take a little bit more time, Linda, and then I'm going to ask the others to respond. A lot of what each of you were talking about was advocacy and the effectiveness of advocacy at the local level. Can you talk about how you take that advocacy strategy and scale it?
So advocacy at the community level is very, very grassroots. So in Albuquerque, very conservative Republican mayor, Richard Berry, and a little bit lefty social services community. And they were able to come around together with the mayor saying, if it saves money, I'll support it, and the advocates saying, it's the right thing to do. So their campaign in Albuquerque was Albuquerque heading home, and the tagline was, the smart way to do the right thing. So that kind of having the information on how much money is being saved and lives being saved are both really, really important. And so the other thing that I think is probably our most effective advocacy for community solutions has been the stories we've been telling. For a while, as part of the 100,000 Homes campaign, we had Good News Mondays, and we had a picture like Ed Givens every Monday that said, this is what the person looked like when we met them on the street and did their survey, and this is what he or she looks like now as they've moved into housing. And I think telling the stories really well, working with communities to be able to tell their own story, and we have a communications person that works in communities to help them tell their own story. But the third part of that for advocacy for us has been more on a national level, where we have one person on our staff who only does strategic partnerships. And a lot of what she does is work with HUD, work with the VA, work with the Interagency Council on Homelessness. So it's telling the stories, collaborating across lines and across ideology. Town Hall, which is a very conservative publication, has just published, without any input from the 100,000 Homes campaign, published something about how well the 100,000 Homes campaign worked, with the first paragraph being, home is a conservative value.
Interesting, interesting. Folks, you can start lining up as we ask the other two to talk a little bit about advocacy.
So I would agree with what Linda said. And then I guess in addition to that, what I would add is the power of kind of like nationwide collaboration. So there was a lot of discussion, I think, up here today talking about the nuances of what happens when you have things that are done at the grassroots level. So taking a model, but then allowing room for people to be able to meet their individual needs. And I know the environmental mantra is like, think globally but act locally, and I think that that's a good example of that. But I think also when we start to realize that there are so many communities that are experiencing the same things, having a coalition or network of organizations, kind of like different agency folks that are working kind of like from within the agency to really be able to come to some consensus around national and local I guess advocacy strategies to be able to implement. So it sounds like 1,000 Homes has like a network of kind of like individuals that kind of like work together to really uplift the localized voices while making sure that they all feed into this national kind of campaign strategy. And I know that environmental justice organizations and environmental organizations and a number of different public health folks have had to figure out ways to work in collaboration. And I think one example of that, although it hasn't been going well in terms of like the policy side, is a lot of the work that people have been trying to do around chemical policy reform. Like, we recognize that the Toxic Substances Control Act nothing's been done to it over the past 30 years, but you had kind of like individuals that do reproductive health work, individuals that do environmental health work, individuals that do environmental justice work that are coming together to really uplift kind of like state policies that have been working and try and use those to be able to then leverage like the EPA and other organizations to then do the right thing, and to also hold industry accountable when you need to be able to get them moving in the right direction so that you can have kind of like this sea change occur.
I guess the only thing I would add, I think in a problem like homelessness, and I suspect also in environmental justice, the problem is one that is inter or cross-sectoral. I mean, these problems are not confined to a particular service delivery organization, agency, funding source. They're like community level problems that really can only be effectively addressed at the community. So I think especially with problems like that, the kinds of approaches that are advocacy approaches are sort of required, really, because they're the only way to mobilize, I think, sufficient energy and activity across sectors to address complex, problems like this.
Thanks. Could you state your name and your organization, please?
There's an on-off switch, it's just a slider switch.
Okay, great. Here we go. All right. Hi, I'm Marie Shaw. I'm with the Institute for Healthcare Improvement. Thanks all for each of you for your presentations. I guess this question is, at least to start with, for Linda. I was struck by the progression that you outlined, okay, starting with the sort of the prototype that you developed in Times Square, and then moving to sort of the prototyping stage as you described it, and then moving to spread and scale. And we think that progression is really important. And going back to what Rashad said earlier this morning, beginning a scale effort with you begin at the beginning, but you have the end in mind. So one of the things that I wanted to ask if you could say a little bit more about was what you learned as you went from that initial sort of pilot to the prototyping, and then further on, because I think it is a question of learning as you go, and how do you continue to build your model as you're doing that?
So what I didn't say this morning is that IHI has been a partner with us from absolutely the beginning, and I'm so grateful. When I first got involved with the campaign, Joe McCannon was there up on stage with me. So
Joe's here as well. That's
I know,
right. Yeah.
and I'm just so grateful for the model that you all developed and then shared with us, and Christina Gunther Murphy, and anyway, it's just been wonderful. So all of that said, I think of the process of spreading and then going to scale as an iterative process. You do something, you screw it up, you figure out what's screwed up, you go back and say, how would I do it differently? In the beginning, we went out to every community that wanted to do a registry week. We went on site with them and worked with people, and were there 3 mornings in a row at 4 o'clock in the morning, and we couldn't sustain that. So recognizing what is not sustainable, I think, is one of the things. And so we started doing boot camps where a dozen communities would come together. We'd teach them how to do it, and then they just all go take the materials and go do it on their own and do it very differently in different communities. So you have to be willing to let go of things, and your idea of, well, of course you have to do this, and you have to have, you know, McDonald's cards or some kind of gift card that you give to everyone who does a survey. And, you know, and other places say, we're not bribing people for, you know, for giving this information so they can maybe get housing. So letting go. And, you know, when Paul Howard came back to us and said, letting communities develop their own goal for what they're working on is going to get us right to the 30,000 homes goal line.
That's great. That's a
Yeah,
great
and so
example.
using
Thanks.
using what he learned and then going to the communities and having to say, oh, well, we just changed the rules. You don't mind, do you? So, that was hard.
Yeah, right. That's a great example, because I think sometimes, you know, you want to try to anticipate what the needs are, you know, as you're taking things to a fuller scale. But sometimes you don't know, and you have to learn as you go. So,
It's all iterative, I think,
Right.
As our lives are.
right. Thank you.
So let me just do a quick follow-up to that question, though. If each area or each locale does it their own way, how do you collect data to show that, in fact, this is some sort of a coherent model that you can begin to evaluate across the different sites?
So there were things that everyone had to agree to. You had to agree that you would know every person who was homeless in your community by name with enough information to triage. And you didn't have to use our tool, but we had a tool that people could use to do that. You had to agree that you would house 2.5% of your chronically homeless population every month, and you had to agree that you would report every month how many people got housed. So those things were not negotiable.
Okay.
And in the beginning, people didn't report, and so we decided we'd have a fully committed list. And if you knew everyone by name and you reported every month, you were part of the fully committed list. And people were just crawling over each other to get into this very exclusive club. And then we added, now you can be part of the 2.5% club. I mean, how original is that? If you hit 2.5%, you're part of the 2.5% club. Yellow buttons that probably cost 10 cents each. People are like, can we be part of that? Yeah, you just house 2.5. So, you iterate and you keep saying, but we had those 3 goals that everybody had to agree to.
Right, great. Yes,
I'm Debbie with Nemours.
it's on.
Okay. And I really appreciate the panel. It's been great. One thing we've learned at Nemours is you really have to be intentional about doing spread and scale. And so at Nemours, we actually created a national office just with that focus. So that leads me to the question I have, which is, how are each of your organizations, what's your business model? I mean, who pays for the work you're doing to spread and scale? And you give us some thoughts about what was your journey to that business model?
Yeah. Well, I think I think I may have already tipped my hand by saying that I think that for many people who are involved with development of innovation, let's say in the field of social services, and I suspect in healthcare, I think that the support for developing a thoughtful, effective business model or infrastructure to support spread doesn't exist. I think that it's probably fair to say that individual charismatic leaders who really believe in what they're doing and who are able to sort of put together resources to pull it off have been successful doing that. But I think that is a gap in sort of the levels of infrastructure that have been developed that seek to bring evidence to to community in terms of to improve health outcomes. I was really I'm very interested in the idea of thinking through as you start to develop the innovation and test it and try to demonstrate efficacy and effectiveness, from that point to be thinking ahead to what's the spread model or what's going to be the, and I can't, I mean, that's so far from my experience in terms of what I've seen in terms of development of a program innovation, at least in the social services field. I mean, it sounds laudable, and but I think we rarely see that in reality. Maybe you know, at the large scale public health world that exists, but I think there's a big gap to there.
So I guess I have 3 points. The first one is I think I like to acknowledge that the idea of like spread, scale, and what this relates to as strategic planning is also like a privilege. And so I think that why I consider that a privilege is I think a lot of social service organizations, community-based organizations, they're a lot of times focused, and this I think also happens with the people that we're working with, on near-term goals like keeping the doors open or like making sure that we have enough staff, that getting to the point where we actually have support to be able to think about like what is our theory of change or what is our framework that we're going to be kind of like doing is really helpful. And so I think that in environmental and community-based kind of like work, there were kind of like 2 real points where that was able to happen, and one of them was where there was very strategic kind of funding and support from the National Institute of Environmental Health Science to really fund community academic partnerships, where you had a lot of community-based organizations who had a need around citizen science and things like that, and they were forced to partner with academics. Sometimes it was a good tension, sometimes it wasn't, to be able to figure out ways to also translate that science into real practical kind of like things that could be used in terms of like thinking about asthma home management programs and things like that. And then there's also an investment in leaders within these community-based organizations. So they went to trainings. Foundations also put in support to be able to like provide, I guess, funding for that privilege part to happen. So like, okay, you're gonna develop a business plan and a theory of change, and we're gonna give you funding to work with a consultant to be able to do that so that you can get on the right track to transition to maybe scale up your organization. And so that really, I think, provided an opportunity where you had a huge increase in kind of like these gains in, you know, what happens when we actually have like wraparound services for people that are in asthma programs. What happens if we take and change like a lead-based pain intervention program to a healthy home intervention program, so that a community health worker is going in and not just pointing out lead, but pointing out lead, mold, and finding ways to get people services, provide them with support so that they can get to the doctor, all those things. And so I think that it's really interesting because there's the Harlem Children's Zone model. And I think one thing that's really interesting about that model is it's like provides a lot of money to be able to test out what like the nurturing network that you need to be able to succeed. And so I think as we begin to think about those, we have to think about the cultures of things that people are involved in, because once you transition people to having like a foundation that really supports that, I think you'll probably see this in the homeless work that you do, you see these tremendous gains, but that's what it takes. It takes a tremendous investment for us to really be able to like, you know, get people to push forward.
That goes to the program infrastructure component that includes the planning.
I was going to say that we had a real privilege of completely piggybacking on IHI and, you know, and being shaped and supported by them in our initial work of the 100,000 Homes campaign and continuing work. And so that was really helpful. The fact is we had a very clear plan, but we did our actual planning, you know, for not more than 6 months, because you know, we had our goal, but we planned for 6 months and absolutely rigidly held to those 6 months plans. And our support has come really from a variety of places. First of all, let me just say that we have a staff member whose job is strategic partnerships, and we don't do fundraising per se anymore. We developed strategic partnerships with people who have resources, and they have been willing to support us in the work that we're doing. Our funding comes from corporations, from foundations, and from the federal government. So it's a diversified model. We also, the founder of Community Solutions is Roseanne Haggerty, who was a MacArthur Fellow, who is part of Ashoka, who's, she's got great connections. So it's an array of things that's really made a huge difference.
So my apologies, Neil, we are going to have to cut our conversation off now. Hold those thoughts, and please, let's give a round of applause to this panel. And if you have additional questions, catch them at the break. And Debbie, I'll turn it back to you for the next panel.
Thank you.